learn together and grow. And it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Anshumala Shukla Kulkarni, who is present here with us, and she will be answering to some of our questions regarding today's topic, which is endometriosis. And I know there must be many questions regarding this topic. So before jumping to the questions directly, doctor, please tell our viewers something about yourself.
So Ria, thank you so much for having me on Narikaa, first of all. And I am a gynecologist. I practice only minimal access surgery. So I specialize in doing a branch of gynecology and obstetrics, where we do surgeries through minimal access routes like laparoscopy, robotic surgery, etc. Been working here in this field for the last 17 years.
All right, thank you, doctor. So moving on to the next question, which is what is endometriosis and what does it do?
Endometriosis. Endometriosis is an enigma. Okay, there is no real reason why it happens. It's something people not even heard of. I'm very, very happy that we're doing this to educate everyone about what endometriosis is all about. It's a condition which is present generally in women who are in the reproductive age group, which is between 20 and 45, and it is a very painful condition. It's something wherein the lining of the uterus, a similar lining is growing outside in the rest of the body, and it reacts exactly the way the uterus lining reacts. The lining inside the uterus, which sheds every month and gives you periods, this lining of endometriosis also sheds blood every month. This shedding of blood that happens causes extreme amount of pain. It can cause a lot of things. It can cause heavy bleeding, it can cause extreme pain, and it can cause problems getting pregnant. So that's basically what endometriosis is all about. It has a lot of other offshoots like adenomyosis, deep infiltrative endometriosis. So it's a very wide array of problems that women can go through. The prime complaint being pain.
All right, thank you, doctor. So when does endometriosis usually develop?
Endometriosis was typically, like I said, it is like the lining of the uterus which is growing every month and giving you periods. So it's the same lining, similar lining tissue growing inside the abdomen, giving you pain with your periods. So typically, you would expect that this is to be occurring when periods are on because it's hormone responsive. It is responding to hormones which are coming into your system every month, right? But we have seen endometriosis occurring in very young girls also. The most common age is between 20 to 45. But we've seen adolescents, which means young girls who just started menstruation, also develop endometriosis. And we've also seen patients who've had menopause, which means periods have stopped. There are no hormones, but they still have an active endometriosis growth. So it's a very wide array that endometriosis can come up with.
All right, thank you, doctor. So the next question for our viewers is how many stages are there in endometriosis?
So endometriosis typically, see the problem with the endometriosis is the treatment options are very varied as well as the presentations are very varied. And from one doctor to another doctor, the communication about how severe a problem is and how we must be treating it was depending on how we classify it. So there is a new classification by the American Society which grades it into four different groups, which is a grade 1, grade 2, grade 3 and grade 4. So these are four ones, of course 4 being the worst because it's the maximum amount of endometriosis growing, and grade 1 obviously being a minor disease.
All right, thank you, doctor. So the next question for our viewers is what is pelvic exam and why does it happen?
So endometriosis is an enigmatic disease, I told you, right? And it is something which defies diagnosis. It is very difficult to diagnose endometriosis very quickly because every one of you know that whenever you started off your periods and if you had some pain, it was told to be something to be acceptable and okay to be with because pain is supposed to happen with periods. Now, endometriosis pain is very unlike your regular pain that you get with your periods. This pain is pretty severe, longer lasting, and very often ignored because pain is supposed to be something which is normal. So here is where pelvic examination helps. Now, what we do is when we have a patient who's complaining of pain, sometimes ultrasonography, which is done generally for looking for cyst in the ovary or endometriosis, is completely missing the whole point. But we do an internal examination. So we actually examine with our fingers to notice what is the orientation of the uterus, where is the intestines adherent, urinary bladder adherent, and we are able to make a judgment about where endometriosis is, where it is stuck, whether it is stuck, it is not stuck, things like that. So that is one key area which actually helps us to diagnose endometriosis where everything else fails. So a patient is coming to me with pain but has a normal ultrasound, and when I examine, I feel the painful nodule. So then I know I'm quite confident to tell the patient that yes, this examination is telling us this is there, and I'm sure the only way to diagnose it correctly would be to put a telescope inside and have a look. But for sure, that shows endometriosis to be present. So pelvic examination essentially is examining with your with your fingers. Yeah.
Alright, thank you, doctor. So, what is superficial peritoneal lesion?
So that's where I said there can be these little. So that comes in a grade one endometriosis where there is these small tiny dots. Sometimes when you're doing a laparoscopy for a patient who's infertile, who's not able to conceive, and you do a laparoscopy, what you see is that there are small little dots of powder burn lesions, we call them. So it's like a matchstick burn thing. There's a little black dot and whitish fluids around it, or there could be bulbous watery fluids around it. These are all small incisions seen around the uterus. They are not involving any organ per se, but they are around in the peritoneum, around the covering, the lighter covering around the uterus. It is seen over there. That's called peritoneal lesions. Yeah.
Alright, doctor. So, what are the symptoms that are caused due to endometriosis?
So the most important, Priya, the most important symptom that is signifies endometriosis, the hallmark of pain of endometriosis is pain. Pain which comes with even before your period has started, pain which remains with the periods from day one onwards to day two, day three, day four sometimes. Sometimes pain which occurs even in the mid cycle, 15th day, 14th day of the period cycle, or pain which is occurring all through the month without any pattern whatsoever. But it's a pain which is so severe that does not allow you to do your routine activities. So you must understand that when you say normal period pain is a very short pain which occurs when the period has just about started, just for a day or 6 hours, 12 hours, or maybe maximum a day. A little bit of rest takes care of it. But if you're experiencing pain where you're fainting with pain, you have to go and take injections for the pain. You can't function. You find it difficult to pass urine, which is very painful to do that, painful to pass stools. All these are signs of pain, which is signifying endometriosis growing at different points inside the pelvic cavity. You can also have pain which is extending down to the legs, to the buttocks, to the anal area, which is again a pain which is occurring near the nerves in the pelvic region. So pain remains the first and the biggest hallmark of endometriosis. The second thing that can happen if your endometriosis is inside the muscle of the uterus, it can cause what is called as adenomyosis. Adenomyosis makes the uterus muscle wall very thick, and that leads to excess amount of bleeding and brownish color spotting occurring all the time. Both of these things, of course, will damage organs inside. So when your ovary is involved, your fallopian tube is involved, endometriosis can cause it difficult for you to get pregnant as well. So you may find that patients who have mild, moderate endometriosis are actually diagnosed with endometriosis because they have been unable to get pregnant, and they get a laparoscopy done and they find out they actually have endometriosis. So pain, heavy bleeding, and infertility. They are the three things that are the main symptoms of endometriosis.
Alright, thank you, doctor. And what are the other symptoms that can cause due to endometriosis?
Very rare symptoms that are there. We've seen, Ria, that there have been patients who have developed bleeding in the lungs because of endometriosis. This is called as in the pleural area, pleural space endometriosis. So what happens is that these endometriotic spots are actually growing in the lungs, in the lining around the lungs. And then what happens is whenever they're having the periods, they suddenly have a loss of breathlessness and collection in the lungs, which are happening every month. Very rare thing to happen, but it can happen. It is generally seen more on the right side than on the left side. They say it's the tracking of the fluid from the pelvis, which is carrying the endometriotic cells into the lungs, causing this growth in the pleural space. So it's very interesting that they will actually have also pelvic pain, but they will not think or talk about it, but they will be worried because every time their lung will collapse and they will have a collection in the lungs every time after the period is occurred. It's fairly rare, but it has seen, and it's very interesting to diagnose it quickly, because if you see this, you should always look in the pelvis to look for endometriosis as well, because they're both going to go together. That's one very rare form of endometriosis that we've seen. We've seen endometriosis in the urine pipe which comes from the kidney to the bladder. That can also develop endometriosis, can get swollen and stuck where the kidneys get swollen up very well. Sometimes you cut that urine pipe out and reconnect the kidneys back to the urine bladder so that the flow is maintained and the disease part is completely taken out.
Okay, thank you, doctor. So the next question for our viewers is, if endometriosis interferes with the reproductive organ, so does the ability to get pregnant become an issue?
Yes, it does. That's one of the first few symptoms of endometriosis. So pain and heavy bleeding and infertility, which means because an endometrioma is going to affect your ovary, and ovary is where your eggs are there. So if your endometrioma is pretty large and inflammatory, it is going to damage the good eggs which are present inside the ovary and prevent the eggs from coming out and ovulating. A lot of times, this inflammation and adhesions which are formed will cause the tube to get stuck in different places. So again, the alignment of the tube and the ovary is mismatched and misbalanced. Uterus swelling can cause difficulty for the egg to get implanted in the uterus. So it does cause infertility in a very big way.
So, what can a woman do to control her endometriosis symptoms?
And endometriosis symptoms, first of all, needs a good diagnosis. So, most often across the world, the data suggests that it almost takes up to 4 to 6 years for a diagnosis of endometriosis to come through. So, it is that difficult to diagnose simply because pain is something that is accepted by the world, around the world. People just accepted that period should have pain, which shouldn't be the case, but that's how it has been. Thankfully, now we are having all these awareness initiatives, so we should be able to enlighten people, enrich people about this knowledge that no, pain is not something which is normal. Having said that, when you are looking at getting a patient, what can she do to prevent it? Well, once you have endometriosis, getting yourself diagnosed is important. So if you're having pain, make sure you get yourself checked out very correctly. There is nothing as such in lifestyle that can be done to prevent it. However, avoiding things which are inflammatory in the body in your diet can be modified to reduce your pain. Instance, leading an active lifestyle, doing some amount of cardio workout every day will help also to reduce your symptoms to some extent. So these are the things you can do. But frankly, if you have a family history of endometriosis and you are having pain, there's very little you can do to actually stop it from growing anymore, except for taking treatment. I mean, there are medical treatment, but on your own, you can just keep yourself healthy. That's all that you can do.
All right, doctor. So, the next question for our viewers is, if they need any medication, so how does it work?
They do need medications, Ria. So, like I told you, endometriosis is a condition where there is a lining which is growing similar to the uterus lining inside. The uterus lining is something which responds to hormones. Okay, so when you have estrogen, progesterone in your body system, it grows and it forms a nice cushion layer for the pregnancy to wait. If the pregnancy doesn't happen, it comes out. So this cycle is going on every month. Now, this endometriotic tissue is similar to this lining. It is also going to respond to estrogen and progesterone, the two hormones in the body. So estrogen will cause it to proliferate, progesterone will cause it to shrink in size. So medications are generally the first line treatment that you would give to a younger person for pain before you can jump in and think of doing any kind of surgical intervention for them. So medications are generally hormonal. There are also some amount of painkillers which are given, some anti-inflammatory medications which can be given to these patients. But essentially therapy for endometriosis as a first line is hormone medications which are given for a long period of time. So, this is a condition which if it starts once, it is not going to end until you become menopausal. So, it is not something that is going to, on its own, start getting better or treatment which is going to take it away out of your system. Medications, if I start for you once, it will be on for a significant period of time. So, I would say 3 years, 5 years at least. So we do start with hormone medications, painkillers to begin with. There are some injections available which can be given. Generally, these injections are advised to patients before they are going in for pregnancy. So if a patient is opting for a pregnancy or an IVF cycle, which is the test tube baby cycle, then the GnRH injection is advisable because it quickly reduces the inflammation that is caused by endometriosis. But it's not a very good treatment protocol for long-term use. So long-term use essentially is hormones and painkillers.
All right, thank you, doctor. So, what happens during pain medication treatment?
Pain medication treatment has to be given correctly. So there is a wide amount of pain medications which can be offered to the patient. It can start with a simple paracetamol, going on to anti-inflammatory NSAIDs, going on to even morphine derivatives. These are generally symptomatic, so they will take care of your pain when you're having the pain, but it's not really doing anything to the disease. So it is advised generally very judiciously, because long-term use of too many painkillers can cause effects on the kidneys as well. So there is a lot of role to play for painkillers, and you can give them in a cyclical manner. What I generally advise patients is to give a list of three medications which have to be taken 2 or 3 hourly only, if the pain is going on increasing. And the other thing to do for patients of endometriosis is you take the medication before your pain starts, so that you know that you're going to get your periods and your period has started. Don't wait for pain. Before the pain onset has occurred, you must make sure you take the pain medications. It's very important to break this cycle of pain. See, what happens is that there is an impulse of pain coming from your nerves, from the nerves in your pelvis, from your uterus, ovaries. They are generally local responses. So your spinal cord is able to cut those impulses and keep them there and not irritate and worry your brain too much. But if you allow your pain to continue for a long period of time, what is going to happen to you is what is called a central desensitization, which means now your spinal cord is unable to stop the pain impulses from going from your pelvis to the brain. And your brain is constantly getting the sensation of pain, sensation of pain. This is a cycle which gets set, which then in the long run will make you always keep having pain even if the uterus is not there. So the pain impulses actually got set completely. So it's very important for you to not neglect the cycle of pain that starts, and make sure you take care of it there before it explodes and causes central desensitization, which is extremely difficult to treat.
All right, thank you, doctor. So the next question for our viewers is, what lifestyle changes might help the expected woman?
Lifestyle changes in endometriosis has a very, very big role to play. Okay, you have medications which will help to reduce the growth of endometriosis. You have painkillers, but there are certain things which are other than this. Now, you would have to look at all inflammatory foods that you consume. There is something called the endometriosis diet which is followed. This endometriosis diet is something which is not including any of the inflammatory foods like all the white stuff, sugars, refined flour, gluten, dairy. All those things are avoided from the diet, and we encourage the patients to have more of fiber, fruits, vegetables, things like that, which are anti-inflammatory. So following an anti-inflammatory diet, doing some amount of cardio exercise. Cardio exercise releases endorphins. It really helps to reduce inflammation. Patients feel better about themselves also. So it's very important to encourage a very active lifestyle for patients of endometriosis. And the third thing is to make sure that they are also doing some amount of meditation or stress management to take care of this recurring pain which is happening, which can cause certain other depression and things like that with the patient. So lifestyle changes essentially are dietary and exercise regimens which have to be followed.
Okay, thank you, doctor. So the next question for our viewers is, what should women do if her symptoms are not getting better?
What do you do if your symptoms are not getting better? You start looking for another treatment or another option to take care of your problem. It's very often seen that when you start hormone tablets for endometriosis, patients still complain of pain, still complain of bleeding, and they're not responsive. The ultimate treatment for endometriosis essentially is surgical. That's where the maximum amount of effort and is required to give a very good result, where a good amount of pain relief and bleeding issues can be taken care of. There are other options of using an intrauterine device with hormones. A lot of things are available which can be done in conjunction with surgery to help the symptoms.
All right, thank you, doctor. Thank you sharing your informative views on it. And I hope this session was really, really helpful for all the viewers out there. And before leaving, doctor, is there anything else that you would like to share with our viewers?
Yes, what I would definitely like to share with all of you is that it is time for us to recognize endometriosis is a condition which is pretty serious. Women are not meant to tolerate pain, so don't discourage when a young girl comes and tells you that there is pain in her periods and it's nothing, it will go away after you get married, it will go away after you get pregnant. This endometriosis does not go away even if you get married or you get pregnant. It still stays with you, it still causes pain, and that recognition of that pain as being a problem is very important as the first step at home. The second step being making sure you seek a qualified person who can recognize your endometriosis and treat it correctly. Because not one solution fits all, so it's not always going to be medications, injections which will help you. There are some who do well with surgery, there are some who do well with medications. So it's important to tailor the treatment according to how the patient is, what is the age, what are the requirements of the patient in terms of fertility. So do not discourage patients who come to you with pain. Make sure you always go for an expert on endometriosis to diagnose it correctly, treat it correctly, and make sure you seek help correct before you develop anything like a chronic pelvic pain syndrome, which is very, very difficult to treat. Patients with long-standing pain will continue to have pain even though they are not actually having any problem at all. Now, that is something that requires a lot of medications and a multi-specialty team. Also, endometriosis surgeries can be pretty difficult. They are generally involving other organs like the intestines and the urine pipe, and it generally requires a multidisciplinary team to take care of it. So, these are the key points to remember about it, and let's hope that this video actually does reach out to a lot of you people, and you are able to talk about it more openly and seek help in a better way, in a quicker way to treat and diagnose endometriosis. Thank you.
All right, doctor, that was really a great response. And it really means a lot to us to be with you in our Narikaa talk show. And thanks a lot for your precious time.
Thank you so much, Ria. Thanks, Narikaa, as well, for giving me the opportunity to speak about this topic, which is of my, heart's interest. Actually, yes. Thank you.
Thank you, doctor.
Thank you so much.
So we will see you all in another next session with another interesting topic. Till then, to all the lovely viewers,